Hi, my name is Marat Fudim. I'm a heart failure cardiologist at Duke University. I'll be talking today about an upcoming paper around home sleep apnea testing cardiovascular disease. So this manuscript really was intended to bring an unusual topic, which is totally in the domain of cardiovascular providers, cardiologists, nurse practitioners, nurses, around the topic of sleep apnea. We really don't often think about sleep apnea, diagnostics, or even therapeutics, yet it is totally within our domain. So the idea was to cover the concept of diagnostic testing for the cardiovascular provider, without calling it dumbing it down, but actually dumbing it down because we often don't think about it, don't learn about it. It's not even covered in medical education, how you do diagnostic testing for sleep apnea. But to take it up a notch, the sleep apnea field has evolved dramatically to where we now have more than ever before opportunities to do home sleep apnea testing. The concept of home sleep apnea testing has evolved. So we want to bring sort of the up-to-date on that to the cardiovascular provider. We hope, co-authors and I hope that we can educate a broader audience that is, again, not exposed to diagnostic testing. Diagnostic testing in the United States is often abdicated as a responsibility, given away as a responsibility to the sleep docs. For every cardiologist, there's like 0.1 sleep doctor out there. So we have to own the space. And again, sleep apnea testing was really complex years ago. It had to be an inpatient sleep study, or you had to go to a hotel. It has gotten a lot easier, and the home sleep apnea testing is so easily available now and orderable now, and the interpretation of it has been really made very simple as well. So the idea is that the impact of this will be that some doctors pick up the paper, read it, and say, hey, I've never heard of home sleep apnea testing. Let's go ahead and let's try it out in my own practice. Let's diagnose some people with sleep apnea. Let's treat them appropriately and timely. This is a super important question. First of all, sleep apnea is highly underdiagnosed, commonly present in the setting of obesity if it's obstructive sleep apnea, but often independent of obesity, even particularly in certain racial demographics. For example, East Asians might not meet criteria of what we consider in Western standards of obesity, but they actually have a higher prevalence of obstructive sleep apnea. Now, central sleep apnea is completely independent of obesity, which is one of those common things we look for, and then simply ignore the fact that they might have central sleep apnea, which is one form of sleep apnea. So that is as to need to screen this leads to the point that we need to screen these people broadly. The problem becomes that we become a checkbox society in cardiology. We're actually very similar to pilots. We have a checklist we have to go down. These are the things we need to start them on medication-wise. This is a device that needs to be done. And sleep apnea diagnostics is actually not one of those checkboxes in majority of cases. So the idea for us is that we're introducing that as a checkbox. When is the appropriate time to introduce a checkbox? This is what we discuss in this instance. And just to give you a little a peek into this paper is, of course, going to be around the time of discharge, when we often new diagnosis of heart failure being made. When you do this echo to assess patients for ejection fraction, that might be a good time to also do some additional diagnostic tests. And since it's been so easy now to order those tests, you can order it a lot easier. You can get it done a lot easier and faster. The high-risk populations of interest are very well established in the electrophysiology space. They actually have in their guidelines that sleep apnea needs to be diagnosed and managed in order to reduce the burden of AFib. That is before the ablation, after the ablation, and everybody in electrophysiology is thinking of ablation. So for the EPs, it's relatively easy. They have established very well. In a heart failure space, not very well established. In a valvular space, and I could go on and on, every cardiovascular disease has a very high prevalence of sleep disordered breathing. So we go through those disease states as well that you could strongly consider to screen early and frequently. The American Heart Association, one of our major leading institutions in the United States that writes these guidelines, actually has recently published a series of statements around the topic of sleep. Sleep is recognized as one of those very important healthy 8 habits we need to focus on. B, sleep disordered breathing has been singled out as one thing that we don't think about often enough. So I encourage people to read that. Now, sleep disordered breathing is recommended to be tested for. These conditions have been often mentioned about. We actually provided just a different lens on the same point or same problem. We just say, how do you actually test it practically? Because I think many of these scientific statements glance over the fact that at the end of the day, cardiovascular providers just don't think about it because they don't even know that they're empowered to measure it, empowered to teach the patient that it can be done easily. We just, again, coming back to the earlier point, we abdicate the responsibility. The sleep docs got it, the pulmonologist got it. No, they don't got it. It's us. We have to take care of it. I think that sleep disordered breathing has not been particularly hot topic at this meeting. By the way, that has been the case for a long time, and I don't anticipate that the cardiovascular community will suddenly start talking about sleep disordered breathing, because it's, again, not being taught in our schools as a comorbidity that we have to own. But I do tell you that because obesity management is becoming more and more something that cardiologists have to deal with through all the revolution in that space, that also the comorbidities are becoming more and more prevalent as something we need to own as a space. I think what you might not see much of it now, but you will see an increase over time of sleep disordered breathing, the diagnostics around this, and hopefully that this paper will contribute to the fact that the conversation gets opened up about sleep disordered breathing and testing for it.